Well, look, I've been attacked that I don't support pre-existing conditions. I've been in a wheelchair as a paraplegic for 37 years. I hope the attack can be better than that. I understand pre-existing conditions. I support the president's executive order that people can keep their pre-existing conditions in the future. I agree with that wholeheartedly. And so the attack on me is not true. Listen, I'm a passionate guy that cares about people having health insurance. I think that the free market gives us the most quality. It gives us better health care. It gives us more accessibility. It gives us to have our own doctor. And if we go down the road with socialized medicine, we're going to regret it down the road and say, what did we do? I can't even get an appointment to the doctor and get my health taken care of without waiting 6 months or maybe a year.
Okay, thank you. Just to follow up here with 30 seconds, how much would your health plan cost?
I have not put together them numbers. Okay, I haven't. I know that the free market, I've been a businessman all my life, and anytime you have a competitive free market system in place, the competition and people in the market always gives you a better quality for a better price. That's worked in America for many, many years. That's why we changed the world with our system, our freedoms and liberties we have as a nation that allow people to compete and allow people to put together the best health care they can. And we got to have more options for people. We can't have just a health program, one fits all. It has to be people, each situation with a different package, a health package with more options.
Okay, thank you. Congressman Golden, we're going to give you a chance to talk about health care now. I want to point to your plan that you released to allow Mainers over the age of 50 to buy into Medicare. You say it would allow 145,000 people in the state access to this program, but we know that Medicare reimbursement rates for doctors and hospitals are far lower than those for private insurance, and by putting that many people onto Medicare, don't you risk straining the already burdened budgets of hospitals and providers, especially in more rural parts of our state?
Nothing costs hospitals more and is more damaging to our healthcare system than having to provide care to people that don't have insurance coverage at all. I think talk to any hospital CEO or doctor about that, and they would agree. The hospitals went out and advocated for Medicare expansion here in Maine, Medicaid expansion in Maine, for exactly that reason. So no, I don't think that would be an issue, and people would be, instead of paying premiums into private insurance, would be buying into Medicare, so they'd be putting more money into that program. They'd also be healthier. Which means less expensive to cover under that program, so they could in some ways be helping to cover some of our seniors who have greater health care needs. On the issue of pre-existing conditions, I got to say, an executive order doesn't cut it. The free market doesn't cut it. Free market is nice when you're shopping for things, but this health care is not a commodity. It's about you and your family's health. There's only one law that protects people with pre-existing conditions. The free market we had before the Affordable Care Act was a healthcare market system where insurance companies chose to deny coverage to people with pre-existing conditions or to charge them outrageously high healthcare premiums. It wasn't affordable for people, and that's why we put into place the Affordable Care Act to protect people with pre-existing conditions.
That is time, and Dale Crafts, you have 30 seconds.
Well, the Affordable Care Act is not performed anywhere near what it's supposed to. When they had the mandates, that was unconstitutional. They took them away. The cost has skyrocketed. People can't have the doctors that they want. And Jared's plan for Medicare for All is going to close down 19 rural hospitals in Maine. People are going to have to travel from Fort Kent to Bangor, from Bangor all over the state to Portland just to get help. It's going to cost $32 trillion for Medicare for All. Government-run healthcare is going to be, the healthcare system is going to be the worst quality you can have if we go down that road.
Thank you. I see the service. Healthcare is one of the most important topics people are talking about every day. I want to give you another 30 seconds. Congressman Golden.
Well, we've already settled this debate. I've already had a conversation with my constituents about where I stand when it comes to that legislation that Dale is talking about. I don't support banning private insurance, therefore I'm not going to vote for legislation such as that. Let's look at the voting records. In the last 2 years, I voted 6 times to make improvements to the Affordable Care Act, because Dale's right. In some ways, it's faced a lot of obstruction and it hasn't worked the way that it should for working middle-class families. We can fix that. We can do things like increase the payouts from the federal government to bring premiums down. For those who are sitting around 250 to 400% of the federal poverty level, we can do more to make this law work for you and your families.
Mr. Crafts, you have 30 more seconds on health care.
Listen, it's a very difficult situation, no question, when it comes to health care. It's very difficult. You've seen on both sides of the aisle, they've struggled many, many years. And they need to sit down, put their differences aside, and come up and help the American people to have affordable health care. There's no question there. We need health care, but I believe America, if you give it time, we will come up with a solution, and it'll be the best in the world like it has in the past, and it continue to be. Our health care can be the best in the world if we just come together and put our differences aside and find a way for the American people.